Much. On this onset, I would like to thank Dr. Ron, APSRS, and AIOS for giving me this opportunity. Now, the path to become a doctor is pretty straightforward. All of us know, and we can, achieve it sometime in the future. But once we become a doctor, and then we just look around. There are so many questions in our head. How do we do? Where do we start? Which machine to buy? How much money I need? So many questions unanswered. It goes. So at this point, we have to remember where you start is not as important as where you finish. Now, each one of us start at different starting points. Some of us start at a point where we hardly have any money in our pocket, and we have our family and friends also don't have any kind of a medical experience. Some of us start in a position where we have a lot of money with us, but we don't have any medical background among our friends and family, so we don't know much about it. And some of us start in a place where your family already has a nice big hospital chain, and you have a lot of money, obviously. So let's look at the first starting point where what if we don't have, or we have very limited money with us, and we don't have much experience in the medical field. In this starting point, we need to be slow and steady. It is very, very important. No matter what specialty you like, be it oculoplasty, be it glaucoma, whatever it is, but make sure your cataract skills are polished, because this is going to be the bread and butter once you start your practice. Spend about, once you finish your studies, when you start practicing, work under an institute or a hospital for a couple of years, so that one, you build up your surgical skills, also your skills, how you talk to the patient, how approach a patient, and also over the years, you can, gain your funds. And it's very important to monitor the inflow, the money inflow, what comes in and what goes out. This is very, very important. You need to monitor every rupee, because at the end of 1 month, you should know how much you will have at the end of 1 year, 2 years, 3 years, 5 years, exact amount you have, so that you can do your proper planning at what point you want to start your private practice. Now, mentors play a huge role in this starting point. Mentors play a role in any starting point, but here a very significant role, because they can really guide you on where to start, how to start, which machine to buy. And because they have a good rapport with all the companies, they can get you a very good deal when you're trying to acquire a machine. And whenever you do start acquiring a machine, it's a good idea not to just buy it out. Initially, you can rent out the machine so that it's not too heavy on the pocket. And then we have a closed mindset when we look at refractive surgery. When we think of refractive practice, we think of expensive laser machines. No, let me not go into it because I don't have too much money. But actually, you can start from day one, even in this starting point, because if you can start off implanting phakic lenses. You don't need any other extra or expensive laser equipments to start your practice, so that by the time you can afford to buy a laser machines, you'll have a good amount of refractive practice also in your clinic. So it is not the salary that makes you rich, it is your spending habits. It's very, very important in this starting point. Now, coming to the next starting point, what if you have a lot of money, but not much of experience in terms of in the medical field? At this point, what you can do is you can go all out. You can, hire really good consultants in different specialties and also have the best machines. You have to make sure your center, no matter what eye problem the patient comes, try not to say that, okay, this kind of condition of the eye we cannot treat in the hospital. That scenario should never come in your clinic. Always you should be able to handle any kind of situation, at least eye-wise. And whenever you choose your location, always do a market survey and then choose a location. And when you're chosen a location, look at your local competitors, see their pros, their cons, and also look at what prices are they charging the patients, so that when you open up the center, you can be a little more competitive when you open for the initial time, so that you have more footfall, and later you can always change as the time goes. Always have a good rapport with your physicians, referring physicians, because every time they refer, you need to thank them. You need to send a mail or message or speak to them that we have received it, we are going to do this kind of treatment. So this way, a long way, if you keep a good rapport, more and more patients come to you. Now, coming to the next starting point where you already have a large hospital chain, and at this starting point, you do not be afraid to give up the good to go for the great. You need a really stepwise approach for this particular starting point. You need to get into the patient's perspective and see what they love about your institute or what they hate about your institute and work on those feedbacks. And then you need to improve efficiency. For instance, you need to lower the lower margin. In the sense, even the smallest thing can be, those soft issues which you use in your OPD, you can monitor on a monthly basis how much do you spend. Is it being overspent, unnecessary wasted, the viscoelastics, the gloves, all these things, step by step, you really need to monitor this so that unnecessary wastage and loopholes for someone to cheat the system shouldn't be there. And also what we need to do is look at the performance of our surgeons in the institute, see how you can help them to push themselves further, make them more efficient, so that way, overall the hospital also grows. And also try to standardize the treatment of any kind of eye conditions so that you improve the quality of your care from your institute. The next thing is, what is very important, we don't give too much importance, is training the paramedical staff. The counselors should know about every surgical procedure that is happening in the hospital. A lot of times they don't know what it is. They think phaco is different, femto is different. They think it's a two different procedure. And also write a script exactly what they have to speak. Because a lot of times we just give a free hand, okay, just talk nicely and then that's it. So they won't know. So you need to standardize this so that you standardize the counseling aspect. The next thing is you need to strategize your expansion plan. Again, whenever you choose your location, you need to do your market survey. Instead of buying out a land and then building the building can be pretty expensive. Instead, we can always look at a plan where you're looking at a landowner who builds the building for you, and you can get into it and rent out the space. So that way, your investment for a new building is lesser, so you can expand even more faster. The next thing is try to have an edge over over your competitors by getting into research. This way, you make sure that your whole team in the hospital is up to date with the latest and the best, and try to do some translational work so that you give back to the community, give back better care and treatment for the patients. But what is common in all these three categories is we need to be humble. We need to connect with our patients. Even if our intention is bad, and you might be, or we might be the best actors, still the patients will get to know. So they'll be, so we can't trick them. So you really genuinely have to love your patients. Automatically the patients come to you. Always encourage the patients to give feedback and try to upload in your social media so that you amplify the word of mouth. And also have a healthy relationship with the competitors. Never bring someone down because, I mean, not just your competitors, even anyone in your life. It's not a good idea. Today, you might be seeing a complication of your competitors, but tomorrow, your competitors will be seeing so many more complications of yours. So please do not get into that vicious cycle. And lastly, I would like to say, keep faith through turbulent times, because definitely there will be turbulent times through everyone's journey, because eventually, faith will always, always heal you. Thank you so much for your time.
Thank you very much, Naren. So while Samresh gets set up, can I just ask you one question? I know your center has both clinical services and a really highly developed research facility. So what's the philosophy of your practice, your center? Do you have a sort of motto or a mission statement? How do you balance, the need for revenue and also the expense of research?
That's absolutely a very good question, sir. So actually, one of our characters of our founding father was, if you look at him, he's a simple man. He never spent money. So whatever money he earned from the institute, he always pumped it back into the hospital or the research. So it was, if we think that, okay, this money is ours and I have to spend it personally, then you hold it strong, then the institute won't grow, the research won't grow, everything. So that is because of his philosophy, his sacrifice, where he didn't buy these Ferraris or big mansions or whatever it is. He saved the money and then pumped it back, and eventually, it paid over the years. And during the growth, it's very important to do this.
Yes. It's such a great point, isn't it? I mean, giving back. Sumpek, do you have a point to make?
No, I just want to know what percentage of your revenue would go into research today?
So right now we are looking at about 4% to 5% of our revenue is going back to the research. But the thing is, it's actually, ma'am, it's more of a long-term thing, because research, I mean, we keep aside a certain budget, in place so that, okay, this is what we require in 5 years for this particular research, because they're pretty expensive, and it's like we need to continuously keep pumping in. And over the years, at least the initial time, we have always self-funded our research. We didn't rely on anybody. But now, since over time we have gained popularity, the institute has grown. Now, a lot of people are interested to fund the research. And
when you need money, nobody wants to give it to you. When you're successful, everybody wants to give it to you.
Exactly, sir.
Yeah, that's a lesson to be learned. Thank you very much.